is that people will come back and they say, oh, I have a disc bulge. And you say, okay, well, when was... And they might not be related to this specific injury. You're just asking them about their medical history. And they'll say, oh, 10 years ago. There seems to be this common held idea that they don't, as you said, they don't repair or they don't resolve in some manner. But the evidence would suggest that there is a reasonable chance for that to occur. How do you think we sort of get that message out about, the education side of that? Because there is this idea of, I hurt my back 10 years ago and so therefore it's a lifelong sentence of back pain, or the pathology will never resolve.
There's probably two parts to that question, the symptoms being either axial back pain or neurological pain, radiating sciatica. So, the axial back pain, I usually say to them, well, really, surgery is not a good thing, for this. You've got to do lifestyle changes, you've got to go see your physio, chiro, osteo, get your core stability exercises under control, accept the fact that you can't dig up the backyard in one go anymore, be sensible with what you've got. Realise that you've got not a normal back, but also patients, they sometimes read the radiology report or the GPs will tell them, this is what you've got, and they freak out. Oh my God, I've got a disc bulge. Well, I can tell you, if I scanned you two guys and myself, you'll probably have them non-symptomatic disc bulges as well. So it can be very dangerous for the patient to read the conclusion of the MRI report. They fixate on whatever the radiologist has said, and the radiologist has got to call it as he calls it. He doesn't see the patient clinically, and he says, oh well, there's a right L5S1 disc prolapse, and they come to me and they say, well, the GP said, I've got to see you about my L5S1 disc prolapse. So have you got any sciatica? No. Well, what do you want me to do about it then?
Well, I think that the better radiologists do seem to comment, if particularly with spinal, I've noticed, they will comment if matching clinical symptoms may be appropriate for X or Y or Z. As I said, some of them don't comment that, but I always find that super helpful because I think it sends the message, at least to the patient, because in your mind you're thinking the same thing. Are the symptoms I'm seeing consistent with what the imaging says? Because if they're not, maybe you're better, as you said, to let sleeping dogs lie.
No, it's not very common for the radiologist to say that. Sometimes I'll say, if clinically appropriate, send them back to me and I'll do a CT guided injection. I think that's good business practice, but that's got to be really a decision between the clinician, the treating clinician, and the patient. So, but it's not common for them to say that. But
one of the things that I wanted to ask you, because it's one of the hardest things I think to deal with, is patients in pain, particularly with the spine. It tends to be not only a very uncomfortable condition, but there seems to be a lot of fear and anxiety around what that means.
There's a lot of negative connotations associated with it.
How do you manage that, obviously with the level of experience you have? Because I'm finding over time, the education that you have to give needs to be able to demonstrate to them that unless they're getting some of those more severe symptoms, as you said, that creates the idea of motor changes or neurological symptoms. The pain that they have, one, has the opportunity to resolve, but two, they don't need to have necessarily these negative connotations associated with that, in the same way that they wouldn't if they, say, really severely rolled their ankle. They can't really walk, it's really painful, but they don't have these negative ideas in their head that, oh no, I'm stuffed forever here. How do you manage that?
It's very difficult to instill realistic expectations into a patient. And sometimes they get frustrated with me or angry with me because they think, everyone said to me, you're the best, so I'm coming to the best, and now I want you to operate and fix it. And I'm trying to point out to them there is no magic wand for this condition. You have some permanent damage, you're going to have to live with it and modify your lifestyle. You're going to have to get some good advice from your physio, chiro, osteo, whatever, and follow their advice. Don't go to them for 6 weeks and think, I'm fixed now. This is going to be a lifelong thing. Maybe you have to go and visit your conservative practitioner, once every few months, get your exercises reviewed, get some hands-on therapy, that sort of thing, and you manage it.